You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the MaternalRx podcast, where we challenge the status quo in pregnancy care and highlight how pharmacists can play a pivotal role in improving outcomes and help reverse the trajectory of preventable maternal morbidity and mortality. I'm your host, Dr. Danielle Plummer, pharmacist and antepartum doula, and I'm so excited today to speak to Dr. Tara Birch, a clinical pharmacist, mom of two, and founder of the Mother Baby Pharmacist, helping women navigate medications during pregnancy and breastfeeding with clear, evidence-based guidance so they feel confident caring for themselves and their babies. Today's topic is a bit broad, but one I am really just beyond myself to dive deep into, because pharmacists are often left out in the field by themselves with wealth of knowledge and are now finally becoming part of collaborative care teams. So today's topic is a collaborative team approach supporting moms to strengthen care. Tara, welcome so much to the MaternalRx podcast. I came across your social media and was like, you have to be on here. And I am grateful you readily accepted. So first, tell me a little bit more about yourself. What brought you into the space of helping moms and babies?
Yeah, well, thank you so much for having me, first of all. I'm really looking forward to this conversation today. It's something I'm very passionate about. I started my side job with mom and babies, focusing on them especially about 2 years ago. I've always had a passion for mom and babies, especially when I was in pharmacy school. But when my sister actually got pregnant, a lot of questions just started popping up. And she was asking me thing after thing. I was like, oh, let me help you find this. You know, it started with her prenatal. What prenatal do I get? You know, like, okay, let's dive into that. And then it just became one friend after the other that got pregnant, and all these questions started arising. So I definitely started diving into it then, but then I found myself pregnant with my first daughter. And that's when it really became, okay, there's an area for this where you have a lot of questions and you need to get answers. That really is what got my foot in the door. And then it was actually my first lactation consultant during my first appointment that said, Tara, you got to do something with this because you have all this information. It's so valuable. I want to use you. I want to use you to help my clients and the moms that I see. And then I just literally started this on my maternity leave. And I had a really supportive husband for starting a new job while taking a break from my other one.
Incredible. Thank you so much for sharing that. You brought to light many topics. What I have found by looking at all the drug resources, they have different answers. And you have to wonder which is correct. When I was working in preeclampsia in the diagnostic space, there was a understanding that aspirin is the safest medication to prevent full-blown preeclampsia and eclamptic seizures. However, when you look at a drug resource about aspirin safety in pregnancy, or when you see Dr. Google, right? And I'm curious now, we should AI this and see what responses we get. It's quite scary. And yeah, moms are really afraid to take aspirin. And if I was a mom who was not a pharmacist, being pregnant, at risk for preeclampsia, and my doctor said, take aspirin, start with low-dose aspirin daily, and I Googled that, it would be quite terrifying. And I have to wonder if women go to the counter and ask their pharmacist, my doctor said I should take aspirin in pregnancy, should I? What would that response be? And now with the change in guidelines as of 2015, the FDA gives a much broader response. If medications are grandfathered in, they're going to come into the guidelines at the time. But now we have to really use our clinical knowledge to say, is this medication safe or not? And that is where you come right into play.
Yeah, and you're 100% right. The answers that the moms are getting, they're getting conflicting advice, and that's the problem. And moms are told different things by different providers, from Dr. Google, which is very popular right now, and especially with AI, it's creating an entire new environment of confusion for moms during some of the most vulnerable times for them as they're going through all these hormonal changes, stressful times, going through postpartum depression, anxiety. Their whole world is changing and there's not consistent information. I actually just yesterday had a mom reach out to me because her dermatologist said that she could take a medication, and then the pediatrician said it wasn't okay to take. So here she's battling two different providers telling her one thing and the other one saying something else. And now the mom's, do I treat myself or do I stop breastfeeding? What do I do here in this situation? So that's where you really have to have that third party team that is the medication expert involving themselves to help them give the correct information, or at least figure out a game plan that suits both mom and baby, because we have to care about both mom and baby in this situation.
Yeah, I can just imagine how that mom felt having this conflicting information from two specialists. It's very scary. Everybody knows what you ingest while you're pregnant or while you're nursing can have long-term effects on that baby.
Mm-hmm.
So how do you make
Absolutely.
that determination? And you are the perfect person to turn to get those answers. I want to
Yeah.
circle back to something you said when your sister became pregnant and was looking at the plethora of prenatal vitamins out there. Like, how do you begin? I once wrote a blog on prenatal vitamins. It's interesting with my specialty being extreme nausea and vomiting in pregnancy. You can't even keep prenatals down. So then you have that fear of, what if I'm not getting my nutrients? So it's a legitimate fear, because if you're not getting the nutrients you need during pregnancy, what happens long term for mom and baby, right? I try to find vitamins that might have some other effects to decrease nausea and or vomiting. There's no evidence-based medicine showing any have that claim. We know claims in over-the-counter products are not held to the same standard as prescription medications, but I also advise on what other dietary needs do you have? Are you kosher? Are you vegan? Are you gluten-free? Finding medications with less filler. If you have an MTHFR gene mutation, are you looking for a methylated vitamin, which did not exist in my pregnancies? They are available now. There's a lot of conflict or debate about that as well. If you don't convert MTHFR, do you end up with too much homocysteine? What did you tell your sister when she was choosing a prenatal vitamin?
Yes. Actually, it's funny because I'm working on a prenatal guide right now to have patients use. It's complicated. There is not a one size fits all prenatal vitamin. It is very patient specific. And you don't really think that when you go into the store, there's so many options. Oh, I'm just going to grab anything. But when you turn that over and you look at the label, there's varying amounts of each ingredient. And some vitamins don't have all the necessary nutrients that you need. They don't have the necessary minerals, or certain amounts are too much, too little. It's definitely a complicated process. So looking back to when I did it with my sister, I actually pulled up the guidelines, started exactly where I needed to be, and what is the recommended amount for a pregnant woman, which is different than a woman who is not currently pregnant. And it's different than when you're lactating. Nutrient needs are variable for both of those. We started there, and then we went through different stages as she went through different stages of her pregnancy. When her nausea and morning sickness kicked in, she was no longer able to take the one that we found was best for her needs. And then, to be honest with myself, when I was going through my pregnancy, when my constipation got worse with some of those hormones, iron wasn't an option for me anymore. And I had to find other ways and change my prenatal. So it is complicated. It's something you have to break down. You have to find what works for the patient to get the most that they can at where they are in their stage of pregnancy.
Well said. It's interesting how you talked about going to the store and seeing all the options on the shelf of prenatal vitamins. I work with a lot of functional medicine pharmacists who have their own, we call them online dispensaries, but nothing to do with marijuana at all, right? Where you can talk to your pharmacist like yourself, Tara. I'm sure you have, one of the options is called Full Script, like an account where they've vetted all the prenatal vitamins and other supplements that are available, made sure there's not filler ingredients, no carcinogens that are in there. And when you talked about looking at the guidelines for recommended daily allowance of nutrients, those are not always accurate either. They're very outdated. And I want to use thiamine as an example. If a woman is getting a full healthy diet, thiamine is like 3.2, I think it's milligrams. But if somebody's not eating, in the case of hyperemesis, you need 50 to 100. But if anyone saw numbers and didn't understand that, that would just seem like poisonous. I mean, that would be my guess, not having studied this. Again, thank you for what you do for vetting the actual, what are the actual numbers, what do you need, and bringing to the point, it changes prenatal throughout your pregnancy and postpartum, and particularly when you are breastfeeding.
Yeah, of course. Yeah, it definitely changes as your body's changing with you. You're growing a human, and then once you give birth to that human, you're nourishing them from your body if you choose to breastfeed. So you actually need more nutrients while you're breastfeeding than you do while you're pregnant, which a lot of people don't realize. They think, oh, when the baby's in me, that's when they need the most. But actually, many things are actually higher at postpartum.
Tara, you brought to light a very important point, and I'm going to repeat what you just said, that most people think it's while you're pregnant and nourishing this baby that's growing in you is the most important time to optimize your nutrients. However, you said that postpartum is a time when you need to optimize nutrients as well. What nutrients are we considering during the postpartum time period?
Yeah, so there's actually a few that you need an increased amount of postpartum. One of them is being vitamin A. This is a common one during pregnancy that you also need, but we watch how much we have during pregnancy because of the effects on the fetus growing inside of us. So postpartum, you do need an increased amount. There's also vitamin E, which the dietary recommendation does go up postpartum as well. So those are a few of them, but things we look out for.
Would you recommend buying separate supplements for them? Or a lot of women will stay on their prenatal vitamins postpartum. Is that something you recommend, or is there a different vitamin you take postpartum?
So generally, I always just recommend keeping your prenatal through postpartum. They do sell postnatals, but to me, mainly it's always looking at the back of the bottle and what is actually in the bottle, because we go into that whole world of no vitamins are regulated or approved by the FDA. So the exact amounts are never great, but a lot of this can also come from your diet as well. So we have to adjust for those factors too. But typically, all lactating women need to be taking a prenatal daily, whether it's a prenatal or postnatal. You need some sort of supplemental nutrient.
The old line of thinking was that water soluble, well, you can't get too much of it. You'll just pee it out, right? Well, we now know that's not necessarily the case. And on the flip side, you want to be very careful with your fat soluble, your A, D, E, and K. You're mentioning A and E. Is there a risk of getting too much, or do you just stick with that recommended daily allowance?
I always recommend going with the daily allowance because there are risks when there's too much. And like you said, like the water soluble, you pee them out and everything. You don't pee those ones out. Anything in a large amount is not healthy for you. Even with water, if you drink too much water, it can cause damage. So I always recommend staying within the limit.
Let's circle back now to the original topic we were going to talk about, collaborative team approach, supporting moms to strengthen care. So collaborative teamwork in a hospital is the best where I've seen pharmacist involvement. You are also a clinical pharmacist, a hospital pharmacist. Tell me about your experiences there and how this can be continued outpatient as well.
Yeah, so exactly what you said, I totally agree. Our hospital system in most places is already built for the collaborative care process. So I work a lot sometimes in the ER or the ICU. And there, especially in the ICU, we do patient rounds in the morning. So you have your clinical pharmacist, you have your dietitian, you have your intensivist, the hospital physician in the ER, you have the nurse practitioner in the ICU, you have social work, you have everyone there on the team rounding on each patient one at a time to make sure that everyone is on the same page so that they get the best care for their safety and for the hospital. So that has been really eye-opening for me, but where I feel that we need more is in the outpatient setting. Once you're out of the hospital, how do we have that team environment? Because like I said earlier, that mom that had to go to the dermatologist, there was no connection between the multiple providers. There's gaps, and we need to fill those gaps where there is that team collaboration. And that's a difficult thing because there's different EHRs, there's different providers, and sometimes different like states involved in this because some people use online pharmacies right now too. So it's a whole world of things outpatient that we're dealing with. But if those can unite, it would be easier for everyone. And instead of one person holding the weight of everything, it would make the workload a lot easier. And instead of the dermatologist having to search on the computer for hours looking up some crazy medication question, he knows he can reach out to this person, find the answer, and then they can relay it to the patient and give them the best recommendations.
Well said. You know, my dream is to have a pharmacist involved with every OBGYN clinic. It just like
we have the same dream.
right? Just like we see pharmacists are now being involved with primary care clinics as well. It's new. State guidelines vary. There's a lot of legislation now allowing pharmacists to be part of that collaborative teamwork, to be billing insurances for their consultations, stepping away from that role of a dispensing pharmacist. And not only is that important for our topic today in medication safety for mom and baby, but also the shopping habits of the American public, and I'm going to guess it's international as well. Nobody has time now to go to your corner pharmacy, stand in line and wait to speak to your pharmacist. So I do love the fact there are remote consultations. When you create a disconnect from where the pharmacist is to these other clinicians, you lose an opportunity that is right there at your fingertips. And that's that knowledge of a doctor of pharmacy to incorporate medication safety into the whole care curriculum.
Yeah, no, exactly what I'm saying, because we lose sort of like that checks and balance when we have the dispensing pharmacy not associated with anything else, or you get this prescription from Amazon pharmacy, this one from here. There's not the checking for drug interactions, and we miss an entire safety net for the patient. And that's really where we need to get all on board and make sure all medications are accounted for every patient, not even just mom and baby, that patients have a complete review when they are seen by any provider, whether you're a pharmacist, a physical therapist, a dentist. We need to look at the patient as a whole.
There's a specialty of a pelvic floor physical therapist, which can help with UTIs, which can help all the women who end up peeing when they cough or they jump. You always see the moms with the kids are on the trampoline, and the mom's like, Mom, come jump on the trampoline. And like, mom's like, I don't want to jump on the trampoline. You don't really know why, but we know why. Right. There's a specialty to help with that muscle support, get the strength back, get the alignment in. If you can get that physical therapy, then there's a potential to get off some of these medications. And I know this is focused on younger women, but I see it in my mom's generation as well. So when you have women going in their 70s, 80s, 90s, living in their hundreds now, we lose a lot of that strength. Women are being put on medications to help with urinary incontinence. You know what? There's opportunities out there to get off those medications. I always say everything we ingest, whether it's a medication or not, could be a supplement, could be food. There's always a risk involved. And we want to make sure the safest things, the healthiest things are going into our bodies. Including pharmacists into this care team is one of the ways to allow this to happen. Tara, you created such an amazing business connecting those missing pieces together. In pregnancy, it's very common not to see your obstetrician until you are 10 weeks along. Looking back to how do you choose a prenatal vitamin, right? Look at other screenings we should have ahead of time. Am I at risk for preeclampsia? Am I at risk for prenatal diabetes? Do I even have diabetes? Hypertension, things that young women would not often be screened for early that might affect a pregnancy. Looking at someone like you working part of a care team, if we can, like I said, see them in primary care offices, in OBGYN clinics, pharmacists need to be part of that care team.
Yes, and exactly what you said, that this is not a cultural norm to be seen before pregnancy. And it needs to be honest, because we know as pharmacists, and the OBs know it too, that the most damage from potential medications or outside factors like smoking, nicotine, things like that, it happens in the first trimester. And if you're not being seen till 10 weeks, well, you don't have very many weeks left of your first trimester at that point. And it needs to happen, and it needs to be a cultural change now for all of our moms and babies. And I really feel like both of our specialties that we can help promote that and get the safety and push for those prenatal appointments, even preconception appointments, because that's when you really should start thinking about things. And for anyone listening, that any woman of a childbearing age should be taking a prenatal vitamin just in case, because most pregnancies are not planned. And so it's really important that we think about that, especially if you are at the family planning stage.
And if a woman has a question first trimester, they're often going to an urgent care or an ER. And those physicians, while they're brilliant, or the advanced practice providers, that's not their focus, their specialty, their education. They are focused on, let's treat your acute need and discharge you and get you out. Yeah, huge opportunity here for pharmacist involvement.
Yeah, exactly. I think that's another area too where we can come in and jump in, because there's a lot of women that go there to get seen because the OB providers won't see you till that 10-week mark. And you're experiencing symptoms at 6, 7 weeks. You get the nausea, you get the constipation, vomiting, and you do go there and you get prescribed stuff. And like you said, they are not the specialists in that area. So that just definitely gives a lot of opportunity where pharmacists could help with the most optimal medication choices for those patients.
You mentioned preconception counseling. Who would someone go to do this? Are you talking to the pharmacist or is there another provider?
So I know there are some providers that offer that. I know a lot of lactation consultants I work with offer this to try to help prep patients for the breastfeeding journey because it is a big journey. Pharmacy wise, I like to offer that to try to get a comprehensive medication review before your family planning, just because if there are medications that need to be adjusted, we get some time for your body to get it out of your system before the pregnancy could occur. But I'm hoping more areas start doing that too, besides pharmacy and lactation.
Incredible. So I did nurse all my babies, and I was a young military wife living overseas. Our hospital did have a lactation consultant, and I remember moving overseas when my daughter was about to turn 1, and that was when the guidelines, I don't know what they are now, you'll have to update us on that one. The guidelines said breastfeed for a year, and I said I breastfed. She's almost 1. I want to wean her. She didn't want to wean. And I was so overwhelmed and lost. And they referred me to a local support group of moms. And now when I think back to that, there were no medical professionals, licensed clinicians, part of that group. Moms are getting information from other moms. This was before social media. Now I think, oh my goodness, what is on TikTok and Instagram and the other platforms that everyone's getting their medication advice today. So Sarah, if somebody wants to reach out to you for preconception counseling, how do they find you?
So anyone that wants to reach out to me can find me on my website at themotherbabypharmacist.com, or they can text or call me at 321-609-5424. Really, you can text or call anytime. I promise I won't answer if I'm not available, but I will get back to you as soon as possible. You can message me on weekends, late at night. I help moms at 11 o'clock at night when OB offices are closed, and they are so thankful. So pretty much whenever you want to reach out, I'm here for you.
Incredible. And I want to add one more topic to this in line with what we've been discussing, because there's a big change in guidelines now for postpartum care. It's quite terrifying. I think generations from now, our children's children are going to look back and say, what? Just like we are doing now to how labor delivery was done in the 1940s, 50s, 60s. My mom said when she went to deliver my sister, they gave you medications that like knocked you out and you wake up and you have this baby in your arms. Now, by the time I came around a few years later, that had already changed. I'm just horrified at hearing that story. Or when I've learned why are women laying on their back for delivery when that goes against guidelines, it's because of the OBs from the 50s and 60s made that a standard, but it's not how women are built to deliver babies. So when we think about postpartum care, there's a standard that you have this baby in a hospital. That's changing as well. There's a lot of more home births. I want to say freestanding birthing centers. Midwives are having a resurgence now in the United States, and I'm really excited. I think they're more open to partnering with pharmacists than maybe obstetricians are at the moment. And there's many reasons that's the case. But like I said, the future, I'm sure, is going to be the standard of collaborative teamwork. Once that woman was discharged from the hospital, mom goes home with new baby. C-section rates are still very high in the United States, which again, there's a time and a place for the right patients, but not for the percentages that we're still seeing. I didn't know till recently that you can't carry your baby up the stairs after you've had a C-section, there's a set time. And then the standard that really is changing that ACOG has come on board with is that 6-week postpartum checkup. So this mom just had 9 months of her body changing, like you said, hormonal imbalances, delivers this baby, goes home and is on her own. And hopefully has a good support team with a significant other or other loved ones to help. However, seeing that specialist till 6 weeks, you mentioned constipation. I'm so grateful women are talking about this now. Happens to almost everyone through their pregnancy at some point. Postpartum is you go home with a new baby and you are just severely backed up. We have a very simple option, Docosay, right, to help with that. But No one mentioned it to me. So grateful to have someone like you here talking about this. What should women know postpartum as far as you said, changes in medications? Any clinical pearls you'd like to share?
Well, I feel like I have many because postpartum is hard. It is one of the most difficult time those first few days. You're overwhelmed with the joy of having a new baby, or sometimes you are in a harder situation where you're just gave birth, but your baby's in the NICU and it's a mess. And you have to also take care of yourself at the same time. So, clinical pearl wise, honestly, make sure you're drinking water. It's a lot. And it seems simple, but you need water to stay hydrated. Your body is going through a lot of hormonal shifts. Most people lose a lot of blood, and some people more than they should. So, water is a big thing for me. Trying to get movement in as possible is one thing that I always try to recommend to help with the constipation, because that constipation does hit almost every postpartum mom. And that's why when we talk about it now, that they check that when you're at the hospital. Have you pooped yet since you've given birth? Because it is a known thing. So water, DocuSate. And then I think the other thing that they all just need to know is that that fourth trimester that you're now entering, that there are resources, and it's just making sure that you can find the resource that you need, whether it's for postpartum anxiety, depression, whether it's for pelvic floor therapy, which is definitely growing right now, whether it's for lactation support or medication support too. Just not to be afraid to reach out for the help that you need.
And for moms that want to breastfeed, they're discharged from the hospital, they're struggling. Tara, how do they find support?
So there's a few options. The lactation consultants, normally at hospitals, they'll give you a paper of ones that are associated with the hospital, and you can make an appointment with them after. At the hospitals around mine, you actually get my information now on discharge, which I'm super excited about because questions will come up quickly. But you can always Google for lactation consultants online. I definitely recommend looking for ones that have all the certifications and positive reviews, just because it is such a vulnerable thing that takes a lot of practice. And if you're putting money into something, you want to get the most out of it. And I've worked with some really great ones here in the Brevard County area that I'm just so grateful for, because they've changed my breastfeeding journey. I'm actually going almost 2.5 years strong on it. And so I couldn't do that without the support of them from the early on times, especially since I had a NICU baby with my second daughter. And it's really the collaborative team approach, which is what I said, and why I focus on this so much, because it is what helps us be successful in motherhood and in the healthcare field.
There's an old saying, it takes a village. And we're going back to that with pharmacists leading the forefront of that village. We are that centerpiece that everything else is circling around. I've yet to meet anybody today that doesn't take any vitamin or supplement or prescription medication, right?
Exactly.
You have connected this piece beautifully. And congratulations on all these achievements you just talked about, as far as nursing your child, being part of that discharge information. And it's not always easy. And when we're in a society where you have to have two incomes today, it's really hard to get by on one income. So moms are in a position now trying to do everything. You seem to have made it very easy. So whatever we can do to support you, we are happy to do so. Tara, thank you so, so much. And once again, I'd like you to repeat, if anyone would like to reach out to you, go ahead and tell us where to find you.
Yeah, you can find me at my website, themotherbabypharmacist.com, or you can call or text me anytime at 321-609-5424.
And is there anything else we missed that you'd like to share?
I think just the takeaway from today is just, if we can improve how we all work together as providers, we can completely change how supported moms feel during one of the most vulnerable times of their life.
Absolutely. Well said. And we know pharmacists are on this forefront: medication safety, prenatal, through the pregnancy, postpartum, whether you're breastfeeding or bottle feeding, we are your source of support. So thank you everyone for listening. And if you enjoyed this today, please do share with your network of pharmacists. And if you'd like to be a guest, reach out to me anytime, and we'll have all this information in the show notes as well. Thank you, everyone.